Welcome to my channel. Today we'll be dealing with a very important topic, that is antibody dependent enhancement. This comes under the pathogenesis of dengue, and before approaching the actual topic, let's learn about dengue. Dengue, it is very common in India, and it is encountered along with chikungunya very commonly in India. Dengue, it is transmitted by the vector Aedes aegypti, and dengue virus has got five serotypes, serotype 1 to serotype 5. Then now come to the pathogenesis. For your benefit, I have divided the infections in a differential format, that is primary infection and secondary infection. Primary infection is when the person gets infected with the dengue for the first time. Okay. If the person gets infected with dengue for the first time, then it is referred to as primary infection. And if the person gets infected by dengue for the second time, then it is referred to as secondary infection. Then most commonly primary infections are due to serotype 1, and secondary infections are more common with serotype 2. And compared to each other, serotype 2 is more dangerous than serotype 1. And serotype 1, it causes a less severe disease compared to serotype 2, which causes more severe disease. Less severe because during primary infection there is formation of neutralizing antibodies. This neutralizing antibodies will neutralize the or degrades the antigen, that is the virus. It degrades the virus and the person gets recovered. But that is not the case in case of secondary infection. Here the non-neutralizing antibodies which are formed, it will instead of killing, it will protect the virus, and this will lead to a very severe condition referred to as dengue hemorrhagic fever or dengue shock syndrome. Don't get confused with these terms, neutralizing and non-neutralizing. We'll be studying them in a short while. I drew this diagram for a better understanding. Let's see. Primary infection. During primary infection, that is the first exposure, so this dengue virus enters into the body, and like any other virus or bacteria, it induces immune system. So even here the dengue virus activates the B lymphocytes. This B lymphocyte will then differentiate into plasma cells, and as we know, plasma cells ka function, it is to produce antibodies. So the dengue virus induces the plasma cells to produce two kinds of antibodies, that is neutralizing antibodies and non-neutralizing type of antibodies. Now come to neutralizing antibodies. The neutralizing antibodies which were formed now binds to the serotype 1 dengue virus. After binding, it neutralizes, that means it degrades the virus, and this degradation or antigen antibody reaction is referred to as neutralization, where the antigen is killed and is removed from the circulation. So the antibody, neutralizing type of antibody, will bind to the dengue virus, and this leads to degradation of virus, and this process is referred to as neutralization. But when there is secondary exposure, right, second exposure, as we said, and the second exposure is due to serotype 2, right? So what happens is the non-neutralizing antibodies which were formed during the first exposure will persist for a very long time. It can even persist lifelong, right? So this non-neutralizing antibodies which were already there in the blood, now they will react with the serotype 2 during the second exposure. This non-neutralizing antibody will coat the virus, and novel function was to kill the virus, right? But over here, instead of killing the virus, it will in turn protect the virus from the immune system. So it will protect the virus against immune system, and that means it prevents the killing of the virus, and thus the virus proliferates and it will lead to manifestation. Now we'll learn what are the manifestation, how they are produced. Like the virus is not killed, but there is formation of antigen antibody complex, right? Antigen antibody complex. So this will lead to activation of complement pathway, classical complement pathway. That classical complement pathway will lead to production of various type of complement that may include anaphylatoxins also. Some complements may act as anaphylatoxins, some may act as chemoattractants, mediators of inflammation, right? So that activation of complement pathway will lead to the recruitment of the inflammatory cells like macrophages, neutrophils, and all those things. All those cells will recruit at the site. Now these cells will in turn lead to release of cytokines, right? This cytokines release will lead to the manifestations that may lead to dengue hemorrhagic fever. For example, interleukins which are released, interleukins will lead to fever, and there may also be cytokine mediated platelet damage, hence leading to thrombocytopenia. And this cytokines may even lead to increased PCV. How? See, cytokines, some of the cytokines causes vasodilation, right? So there may be fluid loss. Due to fluid loss, the fluid component of the blood will decrease. Comparative to the fluid component, the cellular component will increase, right? Because the fluid component decreases, so relative to the fluid component decrease, the cellular component will be more. Then it will lead to increased PCV, that is increased packed cell volume, secondary to fluid loss. Then there may also be cytokine mediated cellular damage, and then which may lead to hepatomegaly, and at last, as I said, there will be fluid loss. So these all manifestations are due to cytokine release. Okay, so this is the reason why the secondary infections are more dangerous than the primary. And as the antibodies protects the virus, hence there will be enhancement in its function, like its effects are enhanced, right? So this is the reason this secondary infection, during the secondary infection, this whole process is referred to as antibody dependent enhancement, because the antibody here protects the virus and it does not degrades it, it does not destructs it, but it enhances the function of virus, hence referred to as antibody dependent enhancement. The summary. So when serotype 1 is the person gets infected with serotype 1 for the first time, he will get recovered because there is formation of neutralizing antibody that will neutralize the virus and the person will get recovered. But on second exposure with serotype 2, this will lead to progression to a more severe disease, right? That is dengue hemorrhagic fever and dengue shock syndrome. And why? Because instead of protection the second time by the antibodies, there will be promotion to more severe form of the disease. And we read the whole mechanism previously, right? And this is referred to as antibody dependent enhancement, because instead of subsiding of the disease, there will be promotion of the disease to more severe form. This is referred to as antibody dependent enhancement. And that's all for today's video. Thank you. If you like this video, do subscribe, comment and like.